If I'm just doing that comprehensive workup where we're looking at diet, we're looking at exercise, we're looking at vitamin levels, when we correct that stuff, anxiety and depression tend to reduce, right? So people who have habitual anxiety, we're like programmed to feel anxious or programmed to feel depression, and that gets magnified when lifestyle's off.
Hi, I'm Jana Wu. Today on The Sober Spill, we have Dr. Chrissy Amicone. Dr. Amicone is a doctor of naturopathic medicine. We're going to talk about all things health and wellness related through a naturopathic lens and explore what naturopathic medicine actually is. Welcome.
Thank you.
So this is Chrissy Amicone, doctor of naturopathic medicine. So Chrissy, welcome.
Thank you.
Can we just start with what is naturopathic medicine?
So naturopathic medicine is an approach to medicine where we use all the same basic sciences as medical doctors, but we learn different therapeutics in the last 2 years of our program, right? So we do pre-med in college. We do the same basic medical sciences in our medical program. We take the same basic medical boards as medical doctors, but then we learn a different approach to treating people. So we learn a foundational approach to treat the cause of the problem, treat the whole person, and use the least forceful interventions as possible, working up a hierarchy as necessary, right? So we would start with diet and lifestyle strategies, and then maybe move up to vitamins and then herbs, right? And then you would reserve things like drugs and surgeries as the highest force intervention, only if necessary, right? So oftentimes when you treat a person from the foundation up, their pathology ceases to exist, right? So if you correct the diet and lifestyle, the diabetes and cholesterol go away, right? And so then you're not needing medications at the top. And so, different diseases require different intervention points, right? You can't always start with diet if we're dealing with cancer, let's say stage 4 cancer. We have to start at a different point in that. But in a nutshell, that's what naturopathic medicine is.
Wow. So it sounds like it deals with a lot more of the subtle that later creates sort of, I guess, the bigger picture, that really influences the whole bigger picture of someone. Can I ask, why did you choose this path after doing all that work? It sounds like in your undergrad. Why did you choose a naturopathic path over a typical Western allopathic medical path?
So I was interested in nutrition, right? And out of the gates, right? When I was in high school, that was my interest, was nutrition. And I was in a nutrition program in college. I was getting my bachelor's degree in nutrition, and my friend got sick and nobody could figure out what it was. And then she went to a naturopath and they figured it out, and it changed her life, right? And so it was like this sort of part of caring for people that was not widely available or accessible. And it was like super interesting to me. And so I shifted gears. I was headed for my PhD. I hadn't started a PhD program, but that was the idea. I was on that trajectory of becoming, getting my doctorate in nutrition, and it overlaid perfectly. Active nutrition is a foundational part of naturopathic medicine, and I had already met most of the pre-med prereqs because nutrition is a science program, so I only needed a few more classes, and I just shifted gears at that point. Once I was in my naturopathic program, my father got diagnosed with cancer, and so during my naturopathic program, I shifted my naturopathic focus toward oncology. So, in my practice now, we're trained as primary care doctors, and I have a focus in oncology. But I should say in Connecticut, I can't practice as primary care because it's not in our scope to prescribe drugs, which is I can't prescribe drugs or admit people to hospitals in Connecticut because of scope laws here. So I'm not a primary care doctor, but I'm trained to be one.
Interesting. So in other states, potentially you could be a primary care doctor?
Exactly.
Yeah. So it's really interesting thinking about, again, all those different components of someone. I know, in sobriety, I think a lot of people start to realize food is our first drug. It's one of our ways of medicating ourselves as well. Alcohol is a substance we take and ingest, but there are other ones too that change the way we feel. And a lot of foods do that. Can you share a little bit more about that? How you see people using food or nutrition either to change the way they feel, in a positive health and healing way, or in a way too that harms them, where they may be getting that effect they're looking for, maybe a numbing, but it comes with a cost?
So that's, I could talk forever about that, I think, actually. So, food is coping in a different way. And the foods that we reach to for coping that will increase our serotonin and our dopamine and all of that tend to be the foods that make us feel worse in the long run, right? So in fact, if we're taking in really high doses of amino acids, we are providing our body with the building blocks to make more neurotransmitters, right? So we can take, I remember when I was working in an oncology clinic, actually, working with the oncologist who was feeling anxiety, right? Which is common when you're dealing with very sick people, right? And he was like, I'm so anxious after lunch. And we decided that he should have like a 50-gram of whey protein shake, and it was so calming to him. It upregulated all of his serotonin.
That is so interesting,
right?
like utilizing protein as a calming agent. Because I think of protein as like, giving you more energy and enervating, like a pre-workout, post-workout, but to calm your nervous
calm you down.
system.
When you get a high enough dose, you
interesting.
can flood your system with these amino acids. But that isn't what we reach for when we're looking for soothing. We are
No.
reaching for simple sugars and
Simple,
carbohydrates.
Yeah, salty,
right?
crunchy.
Yeah, because that's immediately soothing and later doesn't serve us, right? And then later leads us to weight gain and insulin resistance and, which can lead to depression and, all of that other stuff. So I think that it's a non-intuitive thing when we're eating to soothe ourselves. We reach for the wrong things, which I think is common and for most of the things we do to soothe ourselves. It's
So
like this
what
backlash.
would an intervention be then, like a naturopathic intervention in that case?
For what?
For like, I'm thinking about anxiety or depression, like some of the mental health effects. Like, how would you approach that?
So yeah, high protein diet is number one. You have to take a look at the diet. Sometimes they're already eating a high protein diet, and it's not really about that part. So I'll be honest. It's sometimes the point here is that we're looking at what your vitamins are. I mean, most of the time, on a first visit that I have with a patient, no matter what they're coming in for, they haven't had vitamin labs done. Most of us don't know what our B12 level is or our vitamin D level.
I have to interject. That is one of the most interesting things that I've found from like working in a detox. You can have someone come in with a BM. I mean, I know the BMI is not great. It's not a great marker of a lot of things, but basically you can have someone come in with a healthy body mass or an above healthy body mass and be completely by vitamin deficient. We see that all the time in detox, where people come in and they are so deficient nutritionally.
Right. And so a little bit that's about our food choices, right? When we're eating nutrients that are or calories that are devoid of nutrients, which is very easy culturally right now for us, right? But also some of our foods are not as rich in vitamins as they used to be and all of that. But lots of times, I mean, most of the time we are vitamin D deficient in our culture. Most of the time we're omega-3 deficient. Omega-3 is never tested. Vitamin D sometimes tested, right? When you go to the doctor, but omega-3 is never tested. Every single person is deficient. None of us are eating enough fish, and fish isn't available, and it's not that clean, right? And it's hard to eat. And omega-3 is so critical for mental emotional wellness and inflammation.
From eggs too, right? Is
A little
that
bit, a little bit. Walnuts,
Okay.
eggs, a little bit. Okay.
Mm-hmm. Yeah, so it really is important when we think about like that base level, what could make us feel better on a day-to-day level. Where does caffeine fit into this? And like energy drinks, I just bring that up because that sometimes is a big part of sober culture. So where do energy drinks fit in?
I mean, I think it depends on what we're working on. For some people, energy drink, like caffeine is just a critical part of getting through the day. And we're all adrenal. So we're all overdoing it in our culture. I mean, I would say 90% of us are overworking, strapped for time, right? And doing work at home and at work and in school. And so I tend to not try to take caffeine away from people unless we're looking at, there's a few times, right? So if we're looking at somebody with estrogen dominance, which, so estrogen and caffeine use the same pathways for detoxification, right?
Whoa, let's slow down. Estrogen and caffeine use the same pathways of detoxification? That's so interesting. What does that mean?
That means if our bodies make estrogen, right?
Mm-hmm.
Until
even men do too.
menopause,
yeah.
And then that estrogen has to clear the body, right? It has to leave, like everything has to leave the body. It goes to the liver and it needs to be detoxified. And so if we have like lots of caffeine, so people who like will sip on their coffee all day, right? Then they're constantly having that pathway utilized to detoxify caffeine. The estrogen takes the back seat, right? So that's why we see people who get like these tender breasts around their periods or fibrocystic breast disease.
Very interesting.
Yeah. So I'll try to reduce caffeine in that population. I'll try to reduce caffeine in people with insomnia, right? And people who have lots of anxiety. Otherwise, I let it be alone. I mean, we don't have to be purists here, right?
Yeah, I think that's a really important part of it. That's interesting because some of the things we've been talking about on other episodes are sort of like perimenopause, menopause, and women in this like phase of life, like 35 and up, where there are so many hormonal shifts. And then what you just talked about is very similar to what we hear a lot about just in perimenopause in general, like the sleep disturbance, the increase in anxiety, the metabolic changes and shifts. But it sounds like, too, there are just a lot of other factors besides the hormonal shifts that are creating us to have some havoc.
Perimenopause is a hard time, right? So perimenopause, even though it's marked by this idea that we're having decreasing hormones, decreasing estrogen and progesterone, it is still what's called an estrogen dominant state, which means that relative to progesterone, which is on like a steady decline during perimenopause, estrogen is doing these like fluxes, right? We're ovulating and having lots of estrogen, and then we're not ovulating, we're having no estrogen, and we're filling all of that roller coaster, right? Up and down of estrogen. So overall, it's an estrogen dominant state. So we tend to show more estrogen dominant symptoms, meaning like your period will be heavier in that perimenopausal time, right? And you'll have more of those menopause symptoms, the breast tenderness and all of that stuff, right? And so, and just by luck, right? Because we're aging, the liver isn't detoxing as well, right? So, and that promotes that estrogen dominance, and also will promote things like caffeine sensitivity and alcohol sensitivity, where we could maybe tolerate more caffeine and more alcohol previous times. Now suddenly we can't, right?
Wow, that's interesting. On that topic of like the liver too, what is, we know the liver can be really affected, clearly by substances. And we also know the liver can be very regenerative. How does naturopathy approach that? Like if you were to see someone that maybe had a history of drinking, like a lot of drinking in the past, how would you approach some of the long-term liver healing?
Sure. So there are herbs, right, that can, there's certain vitamins that are very liver centric or liver influential, right? Like things like the B vitamins. So we would always be testing the B vitamins and testing functional labs to determine, deficiencies in B vitamins. And vitamin C is very liver supportive. And then there are herbs that can specifically just regenerate the liver, like milk thistle is famous for that, right?
Milk thistle. Yeah. That is so interesting. I wonder then sometimes too, because I know for myself, I do get my vitamin D tested about every 6 months. I get on my thyroid panel, and I will notice if I have like, let's say a Celsius in the morning before I get my blood tested, my vitamin B is through the roof. It is like, so I'm like, wow, that looks like maybe I had some synthetic vitamin B this morning. Like it's like off the chart.
Yeah.
So I think that's interesting that vitamin B is put in a lot of energy drinks.
Yeah. Oh, it's so energizing. So for sure. Like when my kids have games, I overdose them on B12 for sure. And they do better, it's just, this is and it's a safe vitamin to take. It's water soluble. So don't feel bad about your Celsius.
Okay. Okay. That gives me full permission.
Yeah.
I think a lot of us love our Celsius.
Yeah.
So
I've never had one, but
they're really good. Don't start. They're really good.
I won't.
I think too. So with your path, what have you seen? First of all, how long have you been practicing as a naturopath?
So I started practicing I graduated. So I started practicing in 2006.
So almost 20 years ago.
I know.
How have you seen our culture shift in the past 20 years, like that affects your work? And it's a big question, but I'm curious.
Totally. I'll tell you the biggest shift that I've seen. So I specialize in cancer, right? But and so that has evolved a lot recently, right? That whole scene has changed significantly in the last 10 years. But the biggest shift I've seen actually is this post-COVID. Everything is different. Everybody's physiology is different now. And the stuff that used to work really well isn't reliably working anymore. There's this whole histamine sort of shifting thing.
What does histamine do? You say histamine shifting. What's that mean?
Yeah, like I'm seeing a lot of people with histamine issues, like hives, allergies, chronic runny nose, chronic itchy eyes, where they never had that stuff, just allergy symptoms. Even allergy, like histamine related gut issues, which can look like diarrhea in response to certain high histamine foods and all of that. And this was just not as prevalent before COVID. And I don't know if it's related to the vaccines or the infection or both. But it's not isolated. It's like strange. And also treating infections is just different now. Classic, I mean, I've had like tried and true infection interventions for viruses and bacteria, and this is not working now. So it's like, it's really just like trial and error and try to figure out what's going on.
So we got a lot of treatment-resistant things going on. We got a lot of treatment-resistant depression in our world over in the mental health milieu, but it sounds like a lot of treatment-resistant somatic things coming up in us as a culture. Can we go back to something you just said? I'm like stuck on some of these things. I'm like, what are histamine high foods? I've never heard that before. What's that?
Histamine is high in certain foods, right? So it's a kind of a complicated thing. And if you were to like look on the internet for high histamine food list, you'll find like no consistency in that. But one of the rules of them with histamine in foods is that foods develop more histamine as they age. So old foods, like if you eat leftovers by the third day, if you're histamine sensitive, it will be more reactive for you than it would have been on the first.
Very interesting. It makes me think of like people that have a super big aversion to leftovers. I personally don't, but I know people are like will not eat leftovers, and I wonder if it's something like that. Because I do think our food aversions really do tell us something usually.
Sure.
So that's interesting. So
yeah, it totally derails food prep, right? So food prep is a way that we eat healthy all week when we're and if you can't do that because it develops histamine over time, now we're all eating crappy foods by the end of the week. Because
they are faster.
Right? Yeah. So yeah, it's one of those catch-22s.
That's interesting. Yeah. How else do you see mental health showing up in your practice? How do you see people coming to you, or how do people come to you in regards to mental health needs?
So that comes to me in a lot of different ways. I do have lots of therapists that refer people just for mental health stuff. And I think that it's mostly for that vitamin testing, right? So nobody is going to get over a chronic anxiety disorder or chronic depression disorder if they have no vitamin D and no B12. I mean, there's just these foundational things that it's not all just about therapy and lifestyle stuff, right? When we're not working with the right building blocks and right omega-3s and, proper protein intake and all of that stuff. So I do get those referrals. Anxiety and depression tend to be like a component of most visits, even if it's not the centralized reason that people come in. But I do find like if I'm just doing that comprehensive workup where we're looking at diet, we're looking at exercise, we're looking at vitamin levels, when we correct that stuff, anxiety and depression tend to reduce, right? So people have habitual anxiety. We're like programmed to feel anxious or programmed to feel depression. And that gets magnified when lifestyle's off, right? So if you struggle with anxiety and then you have a week of insomnia, your anxiety is worse, right?
Yeah.
Or if you struggle
everything's
with
worse.
everything's worse,
Everything is worse.
Yeah. So it's not always a curative things. If the anxiety is a result of those lifestyle factors not being lined up, then it can go away. But as sometimes it just runs deeper, and there's like a inherited tendency to feel anxious, and then you'll need some like cognitive behavioral therapy or some other level of intervention that's outside of it's out of my lane to work with people on that stuff. But by laying down a strong foundation, we can often reduce the severity of anxiety and depression in general.
I'm thinking naturopathy would partner so well with therapy in general. Therapists, when someone gets to outpatient, they're typically being seen like an hour a week. So that's a lot of other hours a week that someone's not with you, that you're not really doing interventions. So that's pretty cool, the idea of thinking of partnering with someone that they could be working again on the naturopathic side daily, like by changing the way they eat, by the way they engage with what they're putting in their body. It can help then foster the work we're doing just like 1 hour a week.
Right. Oh, for sure.
It's really interesting.
Yep.
I didn't expect this to go there, but I can't help asking, so it's really near and dear to me, but March, if those of you that don't know, is colorectal cancer month. And JAMA came out with a study, and there have been so many studies how colorectal cancer is going to be like the leading cause of cancer deaths for people 20 to 50 it makes me so sad, by 2030. I'm curious, have you heard that at all? Have you seen a huge rise in young people having colorectal cancer or cancers in general?
All cancers.
All cancers, yeah.
That's super exciting.
I've seen it too. I'm sure a lot of us have, people in our lives.
It's true. Yeah, I know. Yeah, and younger people. It's hard for me. Always, it's always been hard for me. So I started practicing, I guess, near my 30s, and treating people who were younger than me with cancer was very emotionally challenging, right? Especially when they would pass away, right? Now that I'm older, everybody's younger than me, right?
Yeah, I've
And
had
so
that
it's
shift
just
too.
definitely emotionally challenging to still go through that. But the good thing, though, even though people are being diagnosed younger, is the treatments are better, right? So not, we still have this tendency to think about cancer as like a death sentence, right? If you were to be diagnosed with cancer, you would start thinking about dying, right?
Yeah.
But really anymore, it's a chronic disease, right? So when you would get diagnosed with high cholesterol, you don't immediately start thinking about dying. You think of it as a chronic disease, right? And we have to frame cancer that way. Not every time, right? Not every time, but oftentimes, especially with young people, it's like we have good treatments, especially when we're working together, uh,
Yeah.
you know, and all the aspects, we can really do all right with it. So
That's very similar, I think, to recovery though too. Um, like substance use disorders don't have to be a death sentence. I like what you said too, like when we all work together and changing and sort of like all intervening as a culture, we can have a shift. That is very interesting. Yeah, I think about that a lot. Like what this is calling us to do, like when we're seeing people get sicker younger, how we can intervene culturally. Because I always say too to like clients I work with, like you don't get sober to feel terrible. The goal is to feel good in your body. And of course, we all have different bodies and different base levels. Um,
that's really interesting. Why would somebody feel terrible getting sober?
I
I mean,
think
besides the process.
there are a few reasons why it can be really hard, especially in the beginning. First of all, there can be like I don't want to say chemical, but there can be the physiological response of pause, post-acute withdrawal syndrome. It can feel terrible. It's actually similar to a lot of the things you're describing, not being able to sleep for almost up to 2 years, like trying to re-regulate your sleep. Having this like anhedonia and like this feeling of listlessness and mild depression, typically it often happens after the first 90 days, which is very interesting that for a lot of people, they hit this kind of like wall. They're like pretty pumped the first 90 days, like I'm doing it. And then it's like, okay, this is it. This is life sober. So there can be a flatness in that. So I think it's the body rebalancing itself on a lot of different levels, but it can be hard to get through. And it can be really hard to have the patience to get through when there used to be a solution that was pretty instantaneous because you could create a chemical change and attempt to titrate it and attempt to control it before with substances or alcohol. And now you're controlling it through much slower interventions, whether it's breath work or therapy, all these other things that take more time than the instantaneous change. So it can feel really hard. And I think the reality is too, in early sobriety, your feelings are just heightened. You feel everything more deeply. So I think that's where sometimes it can feel like, oh my gosh, all this work and this is how I feel.
Right. Yeah. I mean, it's interesting because I don't work with addiction much, but I'm like able to see like there are similarities, right? So when you get diagnosed with cancer, you feel mental, emotionally bad. You might feel symptoms of your cancer, right? Which could also be making you feel bad. It might be painful. You might be anemic or, whatever conditions arise because of the cancer. But oftentimes, and this is interesting when we think about your experience with addiction, is that oftentimes when we do all of that foundational work, it's really normal. It's most normal, actually, that my patients who maybe have a stage 4 cancer and are going through hard treatments with their oncologist will come in to the office and say to me, I haven't felt this good since I was in my 20s. I can't believe I have cancer, right? Because it's like we can't feel good because they got cancer. We did that foundational look, right? And found, look, you're running with no vitamin D. You're running with no omega. You are, you never were exercising. We need to get you outside a little bit. You weren't doing all of those things. And when you put those things together, you can feel really good, even though maybe you have a tumor growing in your colon or somewhere, and it's like, or even though you're doing immunotherapy with the oncologist or radiation therapy or something like that. It's like when your foundation is tight, when it's working right, you can endure those things,
That's so hopeful.
Yeah.
It really is. It did make me think too, again, about addiction that, a lot of people we work with are very fortunate in that they can take some time off or they make the arrangements in life to take some time off to get well, whether it's taking FMLA to come into detox and residential treatment, or taking, some sort of hiatus from work to really focus on their treatment. And it's such a blessing. Similar, not that cancer is ever I would never say that, but there's something to me about when someone is having intensive cancer treatment, the whole focus becomes on that. Like, work has to take a back burner. The other pressures that we were talking about that cause that adrenal fatigue and burden sometimes have to be placed in the back. And I think similarly in recovery, like, you're forced to this critical crisis moment where you have to put those things sometimes on the back burner. Your career will be there later, but you're at this point, you have got to get well and focus on it. And it allows you to go much deeper, I think.
Right. I mean, you have to take the good with the bad, right? You're offered this hardship in your life. You were handed some hardship, and there's a gift always in a hardship, right? There's always something to learn and grow from in a hardship. And so you have to take that good stuff with the bad, right? You have to take this opportunity to go through a mental emotional change, go through a personal evolution, look for the positive things that happen. When you get a diagnosis that makes you think about dying, you can correct the things that you want to correct in your life before dying.
Oh,
right?
I like that.
We don't think
when
about
you get
that,
a
right?
diagnosis of dying, you can correct the things in your life you want to do before dying.
It's a gift,
That's
right?
really,
You won't get that with a cholesterol diagnosis, right?
Yeah.
Yeah. And so it's like you have to take that. So you would never, you can focus on the positive parts because you have to deal with the negative parts. You have to take them both, right? And so it's the bad part is if you don't allow yourself the gifts that are afforded to you by the hardship that you're enduring, right? So, and I would include addiction in that, right? You learn something about yourself, right? Going through that, I would assume, right? It's the hardest thing that you ever go through in your life, right?
Well, and you get the gift of living with your eyes fully open and living life in a different way. I think too, when we think of sort of wrapping this up, I know going back to the colorectal cancer, I think of one thing we can do is preventative care. You can get your colonoscopy. If you have a history of colorectal cancer in your family, you can get it earlier than 45. There are things we can do. What are some things you would say actionable steps we could do to start to take care of ourselves on the micro level that could help the whole macro system?
Sure. I mean, the thing is with all of it, right? So managing your hormones, managing cancer prevention, managing your adrenal glands, managing your stress, it always works better in your body to be, nurturing to yourself at baseline, right? So you have to, feed yourself correctly, right? Feed yourself balanced macros, whole foods that are clean, not emergency foods, not fast foods.
Oh, emergency foods protein bars.
Right. I mean, it's all right. We do what we do. We do what we have to do, right?
Yeah.
But, feeding yourself well, not avoiding a whole macro, not avoiding vegetables, not avoiding protein, not avoiding carbs, right? Even balanced meals, outside time every day, exercising every day, taking care of yourself the way you would care for a baby, right? Going to bed at the same time every day, waking up at the same time, doing something joyful every day, right? Take your kids to the playground. What do we do for ourselves as adults? That's comparable to playing, right? And having fun, right? If you can keep that stuff lined up in your life, you're going to have less nutrient deficiencies, less hormonal imbalances, less neurotransmitter imbalances, right? You'll feel better at your baseline. You'll be able to care for yourself more because you're rested and not depleted. Right. And so it applies to everything. Always taking care of your foundation there makes everything better,
Yeah, I like those steps you just mentioned, though. Even just the simple ones of going outside every day. Remembering, go outside every day. The nutrition ones, I think, can be a little trickier, but, we do live in a culture with a lot of rush, a lot of fast foods, a lot of fast caffeine. So finding those little interventions, I feel is so important. And recognizing, I guess that is the preventative care to the burnout, to the health crisis, controlling the things that we can.
Yeah, I don't mean to villainize protein bars.
No,
Celsius
you didn't villainize
even,
anything. No, you didn't villainize anything. I wanted to go back to something we were talking before about some of the hormonal, I don't want to call them imbalances, but different hormones that we know really affect our mental health. I'm thinking of endometriosis and PCOS. How do those affect our bodies and our mental health?
So both of those conditions are what a naturopath would call a result of estrogen dominance, right? So estrogen dominance, again, does not necessarily mean you have too much estrogen. It just means relative to progesterone, it's too much relative to the progesterone. So estrogen in general is promotes the growth of things. So it promotes the growth of synapses in your brain.
Estrogen promotes the growth of synapses in your brain. That's really interesting.
Right. And so, yeah, and it promotes the growth of bone density. It promotes the growth of muscle mass, right? But it also can promote the growth of estrogen-sensitive tissue, like fibrocystic breasts or breast cancer or ovarian cysts, right? Or uterine fibroids or endometriosis. PCOS is a little bit different because it involves an androgen dominance too, which is separate than estrogens.
What's androgen?
Like testosterone.
Okay.
And so we have to correct both of those for PCOS. But for endometriosis, it's really a primarily estrogen dominant symptom or disease, right? So what we can do to approach that is bring up progesterone, right? So if it's an estrogen dominant situation, we can balance it by bringing up progesterone. If a person will tolerate progesterone, right?
Yeah, I know, because like right now progesterone is like all the rage, sort of on like there's a lot of online women's clinics, and everyone I know, myself, or a lot of people are on progesterone, but I know it can have some mental health effects. It can cause depression for some people, some suicidal ideation. How would you manage that then?
So what's interesting about progesterone is that it actually can activate GABA receptors.
Progesterone activates GABA receptors. Wow, we talk about that a lot in treatment too. That's interesting.
GABA
or just the GABA receptors.
Sure. Yeah, and estrogen actually can stimulate dopamine and serotonin receptors, right? So in a body that's accustomed to feeling estrogen dominant, we are used to having high muscle mass, good bone density, lots of dopamine and serotonin stimulation. So when we correct that, we experience less of those things.
So maybe some depression even too from like the downgraded dopamine?
Down dopamine, down serotonin, up GABA, right? So just think about a mental emotional shift that would occur with those changes right there. So that might be a person that doesn't tolerate progesterone, right? Or even just the correction of estrogen dominance. But so, outside of using hormones to correct something like that, we can use things that promote the appropriate detoxification of estrogen. So as we make estrogen in our body, if we can get it detoxed out correctly, then we see this sort of proliferation of tissues, right? So there's different metabolites of estrogen, and we genetically inherit sort of a way of detoxifying estrogen in a beneficial or non-beneficial way to our body. So there are certain things that we can consume, like cruciferous vegetables, or we can take
cruciferous vegetables, so like broccoli, cabbage. What else are the cruciferous?
Cauliflower.
Yep. Okay.
Or we could take a supplement that has something called diindolylmethane in it, which is what comes from the cruciferous vegetables that will actually promote a more beneficial detoxification of estrogen and reduce that proliferative effect of estrogens in our body. And if we're going to kind of segue over into what happens in the perimenopause period, we feel this decline in estrogen, so less
muscle mass,
less bone density, less serotonin and dopamine stimulation, less ability to generate new synapses and learn and memory.
Is that where the brain fog comes in?
Yes,
mental pauses,
totally.
The blank spots.
That's factual, right? It's factual. Estrogen is very I mean, it's there's science there, and so So as we have dropping estrogen, we experience less of all of that somewhat anabolic or growth in response to estrogen that we're used to. So, when we're trying to mitigate that, we can use estrogen replacement if we want to, that has certain risks too. Or we can use what's called plant-based estrogens, right? Which are called phytoestrogens that are much safer and not associated with cancers.
Is that like a pill, plant-based estrogens, or is it more like soy products?
What we can do with diet or pills, right? Or there are certain herbs that are phytoestrogens, like dong quai. You wouldn't eat that as a food, but you can eat more beans and soy foods. Beans and soy are high in phytoestrogens, and we can help. I've had women that their hot flashes go away when they just drink soy milk twice a day.
Wow.
Yeah, I mean, not everybody.
Yeah,
right?
But that's a pretty incredible intervention to think like that's
soy
cool.
Milk.
That could work.
Right.
Well, it makes you think too, like cross-culturally, like cultures that eat a lot more soy, like Japan and places. I wonder, do they have less hot flashes too? That's really interesting.
Mm-hmm. They do have less cancers. Hormone-related cancers, right?
Yeah. Thank you so much, Chrissy. So how can people find you? Where is your practice or so?
So I have a little office right in the center of Litchfield.
So Litchfield, Connecticut, Litchfield Litchfield Hills.
Yep,
Lovely
right
place.
downtown
Lovely.
there. It's a little bit hard to find, but, we have a website you can find, and you can give us a call. I have a nice receptionist that'll help you find our office. It's a little bit behind, the main street there, but so my website is, my name, so it's Christina Amicone, ND.com.
So C or K?
CHRISS no, sorry, CHRISTINA, Christina Amicone, AMICONEND.com.
ND.
ND.
Naturopathicdoctor.com.
Right. Yep. And my clinic is named Riverstone Naturopathic Health.
Riverstone Naturopathic Health. Wonderful. And
Yeah.
Litchfield, Connecticut. Beautiful Litchfield.
Cute Litchfield, yep.
Thank you.
Thank you. Thanks for having me.
Thank you so much for joining us today. If you'd like to know more about Chrissy's work in naturopathic medicine, you can follow her on the links in the comments below.